Well, Bill and Janine, city leaders say that they have seen improvement since I first started this series of stories, and they're making a renewed promise tonight to do everything they can to support this agency. Meanwhile, some workers still feel like they're drowning. You'll hear from one in this story who asked to remain anonymous due to fears of retaliation.
Right now, we're in a crisis situation.
A crisis situation. That's how some Richmond Social Services employees are describing their working conditions as they continue grappling with extremely high caseloads and not enough staff support.
It has been very overwhelming. Because of the volume of work, we are unable to assist the citizens the way that they need to be assisted.
The city says on average, benefit specialists are working 2,400 to 2,900 ongoing cases at a time, though some workers say they're handling over 3,000 and processing applications that were filed 2 to 3 months ago. That means families in need wait in limbo for help.
So yes, there is a backlog. It's a very long turnaround for a citizen or a client to get the answers that they need or the assistance that they need.
The latest data shows Richmond is still non-compliant with state standards. 97% of applications are expected to be processed in a timely manner, but the city is at 83% for Medicaid, 77% for SNAP, and 56% for temporary assistance for needy families. Workers say not only is the quality of services suffering, but also their own well-being.
A lot of my coworkers are dealing with mental health issues. They're dealing with depression, anxiety. Some have panic attacks. If they really knew in City Hall what was really going on, they would see that the workers are over here drowning.
We see them, we see you, eligibility workers and DSS workers, we see you.
Richmond Councilwoman Stephanie Lynch and Chief Administrative Officer Lincoln Saunders acknowledge the struggles, but they also point to improvements.
Our turnover rate and our vacancies within DSS are declining. They're going in the right direction, but we still have a ways to go.
Right now, the department needs to fill 52 positions out of 400 total, 28 of those to work in benefits after the city allocated dozens of new roles specifically to keep up with caseload demand, which spiked nationally post-pandemic.
The number one thing we need to do is continue to hire and recruit additional team members for DSS.
And the city is making decisions about where their priorities lie. I think there's a renewal and a renewed commitment to invest.
Lynch says that other solutions, which she admits are long overdue, include requesting an overhaul of the state's technology system for processing applications and training the 311 call center to take DSS inquiries.
So we expect to see our funding to go to support the DSS workers in a very real way.
So our members are saying enough is enough. The time is now to make sure that we have the resources and the people that are necessary to do the job.
Lenore Thomas is the president of the SEIU Virginia 512, a union that represents more than 900 city employees. She sent this letter to Mayor LeVar Stoney demanding he accept the union's contract proposal that would address staffing levels and caseload management for their members.
They are coming to the table with solutions to a problem, and they're asking the city to show up and help them be a part of the solution.
And at this point, those contract negotiations that she mentioned are still underway. Now, Lynch says the city is also creating a dashboard of social services data to track the progress of solutions that the city has promised. She expects monthly updates in committee meetings starting in the new year from here on out. In the studio, I'm Tyler Lane, CBS 6 News. Janine?
All right, thank you, Tyler. Now, if you have any information about this story you'd like Tyler to hear, you can reach out to him. Call the number on your screen or email him at tyler.lane@wtvr.com.